Yes, thank you so much for the invitation, and I would like to thank the organizing committee as well, the podium to present a very interesting case. So this was a 9-year-old lady. I've been trained by Hoogland, one of his last students. And, I want to share this case with you guys because I think it's very interesting. This was a 9-year-old lady. She was at academic hospital from Utrecht, which is another the Netherlands, and she was kept on conservative treatment for 1.5 years. So they Googled on internet and they found me, and they found out that I was doing the endoscopic approach, and they came to me asking whether I could do it. And this was a big problem in the Netherlands because it was not being reimbursed. So they had to pay it themselves. And they started some kind of crowdfunding for the payment of the procedure. And then I asked my colleagues, what would you do? Would you do the open approach or would you do the classical approach? And everyone is telling me, because it's very new in the Netherlands to do endoscopy, everyone was telling me, well, you are crazy, you have to do it open and an academic hospital, in the children's hospital, and so on and so forth. But no one in the academic hospital has experience with the kind of sedation I use, and no one is doing this kind of procedures. So I thought, what should I do? Should I do it open in the children's hospital, or do I do the endoscopy? So this is how she came in, and it's just watch her walking. She has a contracture on the left side.
Sanjay, sorry to interrupt. You need to start your screen sharing.
Oh, sorry. Let me see.
At the bottom of your screen.
Yes, I thought I did share my screen, but it didn't went well, I think. Here, share.
Yes, now we can see.
I'm sorry for that. So it was 9-year-old girl, and this is how she walks. Just watch her left leg. Even op de tenen staan, even op tenen lopen, weer terug. En op de hakken lopen. She can walk on her heels. Okay. Helemaal goed. And this is how her MRI looks like. So what to do now? Open surgery, transforaminal. Unfortunately, I cannot ask the audience to get direct response, but after a long discussion with some of my colleagues, I decided to do it transforaminally. And the parents were okay with that because they didn't want the child to get open surgery. And this is how my theater setup is. I do it in prone position using a C-arm, which I can move myself. So we don't need a worker doing that for me. And so this is how her spine looks like. And you can see very large foramen. I'm still out of the canal. I really was afraid doing this procedure in this child. You see, she's very small, and I didn't know if I could make it. But anyhow, we managed to do it. First skin incision, infiltration of the skin, and then introduce the Tomshidi. So I'm here at the superior articular process and out of the canal still. Going to Cambridge triangle. Then start the drilling. And you can see I'm in the middle of the canal, exactly where the disc herniation is. And then taking larger drills. I don't have to explain that to you. And you can see I'm at the Cayman's triangle in the spinal canal, a little bit in the lateral recess. And this is how the endoscopic view is. So the disc material is very sticky. It's not a big sequester which is coming out. It's really piecemeal surgery. Very difficult to remove it. You can see the nerve roots coming here, epidural fat. Now you see it's moving already. And you could imagine that this girl is on the sedation. So she's sometimes crying, sometimes she's quiet, but really scary for me to do it. Because if anything goes wrong, then the whole neurosurgical department will tell me something. So this is the piecemeal material which is coming out. A lot of it has been flushed away by the rinsing. And this is her post-op MRI scan. So you can see the disc is collapsed a little bit. It's black as compared to the other discs. But anyhow, this is the result. And this is how she walks 6 weeks after the operation. Come on. So we've published this in the pediatric neurosurgery very recently, and I think it's one of the youngest cases in the world doing well now. And this is data from my randomized controlled trial, which will be published very soon. And then hopefully we get some information about the fact that endoscopy is not something what we are just doing, but we are showing that the data is as good as compared to open surgery. Thank you so much.